Hi, my name is Dr. Benjamin Bieber, and I'm here to talk to you about one of the best treatments of the century for arthritis. And arthritis is an inflammation of the joint. There's also a lack of cartilage, bony spurring, and cystic changes within the bone. So for severe arthritis, uh, patients have been going for total joint replacement. But stem cell therapy takes the place of a joint replacement, and it is extremely safe and highly successful. And it's used for all joints in the body. The most common is the knee. Instead of a knee replacement, instead of a hip replacement, instead of a shoulder replacement, instead of an ankle fusion. So what do? I take platelet-rich plasma first from the patient, and what that does is that helps to multiply the stem cells as well as bring the stem cells to the area of damage. Then afterwards, there are two types of areas in the body where I obtain stem cells. One is bone marrow, which is inside the bone, and adipose tissue, which is fat. So you can either use fat or bone marrow to obtain your stem cells, or you can add both of them together, which has an additive effect and a better prognostic value. So after taking the platelet-rich plasma, which is from the blood, I take again the bone-derived as well as the fat-derived stem cells, or combine them, and then after the lab work is done, using ultrasound guidance, I can see the needle underneath the skin going exactly to where it has to go. So it's going to be 100%. The stem cells are going to be going exactly where they need to go. Stem cells are neutral, and what happens is it becomes cartilage, or it becomes ligament, or it becomes bone, or it becomes tendon. So it becomes that tissue which is torn or lacking. It also has special type of proteins called cytokines and chemokines, which regulate the inflammatory response, and it also helps with immunity. So if you have severe arthritis of a joint, please contact my office, which is 212-268-8181, and I'd be more than happy to give you a consultation to see if you're a candidate for a stem cell procedure.